Good morning once again, and a warm welcome from Solution Buggy. I think some of you have faced issues today with some technical problems while joining in, but that has been sorted out now, and I'm sure all of them will be joining very soon. My name is Guru Prasad Bangle, and I welcome you today to the third day of AIM, which is the Accelerating Innovation and Ideas in the Manufacturing Sector. It has been splendid 2 days and 4 sessions up till now. We have learned about high specialty chemicals. We have gone through sustainable chemicals, and then yesterday was the day of food and beverage. We have had immense amount of knowledge coming in, and as usual, a lot of questions also coming in from the audience. The audience has been wonderful. Uh, uh, Going through the entire sessions, and I am sure in the next 2 days we have enough and more knowledge that will be coming in. We have today's session has been split into the first session, which will be on nutraceuticals, and the second session will be on the packaging. Before we start off, a quick intro to Solution Buggy to all those who do not know us. We are today India's largest dedicated platform for the MSME sector, empowering industries and connecting the experts to them. Over the last 9 years of our existence, we have more than 10,000 plus highly skilled experts on our platform. And we have executed more than 3,500 plus projects in various sectors. But the most prominent ones are the food and beverage, chemical, pharma, a little bit on the renewable energy side, and as well as on the aerospace and defense sectors. When we say projects, we do right from concept to commercialization, and we take up projects which could be, 1 day kind of consulting assignments, looking at the training or looking into lean management, quality improvement, process optimization kind of projects, to all the way to setting up of an entire industry, which could typically range from 8 months to even 1.5 years. Along with that, we also do market research and product identification, detailed project reports, and feasibility studies. Moving on, we also take up machinery procurement and plant setup, commissioning of the plant, operational support during the first few days, and also help in new market entry and any assistance in contract manufacturing as well. So if you look at us, the entire gamut of end-to-end consultation is what we provide, and that's the crux of the webinar as well, wherein we want to look at the various sectors that are possible for a new entrepreneur or for an existing entrepreneur to diversify into new sectors. I would like to thank all our associated strategic and media partners and the government of Karnataka, especially for encouraging us and helping us in running this webinar series. The topic, as I said, today in the next 1 hour, we'll be focusing on the nutraceutical sector and what are the various value additions that can be done and the opportunities in the domestic and global markets. The sector per se, up until COVID, I can say that, nutraceuticals was, although it was a very prominent sector, but not much, kind of limelight was there on it. But beyond COVID, we all know that the sector has grown a lot, and today we have a separate session itself focusing on nutraceuticals because of the kind of importance that it has gained, not just in Indian markets but also in the global markets. It could be right from herbal extracts or getting into blending of cosmetic products, or it could be wellness products that have come up, and the recognition that the entire sector has gained. So in the next 1 hour, we'll be learning more about this sector and what are the opportunities that an entrepreneur can look at. So I would like to introduce the speakers for the day. Firstly, I am Guru Prasad Bangle, Director at Solution Buggy. I have about 20 plus years of experience in the consulting sector. I am an electronics engineer from RVCE and an MBA from AIIM Bangalore. My last startup, Propergy, was acquired by Magic Bricks, and post that, I am one of the directors at Solution Buggy, and I handle project management here. Next, I have Mr. Krishna Shetty, who is working as a director operations and commercial at Crop G1 Agro Research and Development Private Limited. He has about 33 years of experience in the pharma API industry, spanning the healthcare and cosmetic and the nutraceutical sector. Also moving to agro and the oil and as well as the herbal extracts domain. He's worked in various industries as director and AVP role in the biotech and life sciences division. We welcome you, Mr. Krishna.
Okay, thank you. Thank you, Mr.
Next,
Guru.
thank you. Next, I have my second speaker of the day, Mr. Sundar Rajan, CEO of Z Corp Organic Private Limited. At Z Corp, he's pioneering into seaweed and algae-based functional foods, a very new area, and in collaboration with ICAR CIFT, with a mission to make nutrition more sustainable and accessible. He'll be taking us through his journey and also explore how innovation can be used in the health and wellness segment. I welcome you, Mr. Sundarajan.
Thank you. Thank you.
Yeah. So I think the first session for the day will be handled by Mr. Krishna, and I'll hand it over to you, Mr. Krishna, and your PPT will be coming up.
Yeah, thank you, Mr. Guru. Okay. So first of all, happy morning to all the participants. I think I presume most of you were there in the day one also. I'm the same guy who started the session. Okay, first session, right? Anyway, introduction has been done by Mr. Guru. Okay, I've been in the industry for 30 years, various levels. Okay, so I'm here to share my experiences and enrich your knowledge base to take forward your business levels. Okay, right? Go to the next slide. Can you go to the next slide? Before beginning this session, okay, I want to know, I think most of you must have gone through today's Times of India health special session. Sorry, I could not share because it was morning news. I'm trying to share here if you can see, okay, otherwise later you can see that. Okay. See, I was surprised to see this report. This is for 6-year-old kids. Diabetic is detected at the age of 10. So can you believe it? It is surprising, right? It is alarming. Right? Okay. So kids at the age of 6 and 10 has been diagnosed with diabetes and obese. Right? Many more. This is a heading. That's it. Actually, if you go down the report, plenty such. Okay. And I could not share again my own report. Okay, now I'm negative B12 vitamin. Okay, every day I'm taking the B12 supplements. Right? Okay, I'm 55 though, of course. So if you ask again, why is it happening? Right? Okay, it's mainly because of the low nutrition levels in our body. Okay, and it's again mainly because of our lifestyle. These are all lifestyle based diseases. Okay, see, over the years, what has happened is like we have been fed with the wrong foods, knowingly, unknowingly, okay, right? Because of the commercial reasons of the industries, maybe. I don't want to take the ministries and all here, right? We are not political, right? But anyway, this is the concern, right? Okay. Sorry, go back to the first slide only. Okay. Right. So that is a concern. We know now what is the gravity of the situation, right? Okay. So diseases are diagnosed at the age of 6, 10 and more. Okay, right? Means the kids are born with the diseases. Almost, right? That is where these nutraceuticals play a role. Okay, right? You must have want to know what is nutraceutical, right? Okay, are they medicines? Okay, or what is it, right? Okay. I would say like nutraceuticals are not medicines but supplements. Okay, the name as it says, nutraceuticals. Okay, like it's a nutritions fed into or taken into our body in the form of pharmaceuticals, right? Okay. See, normally nutraceuticals or nutritions are available in a day-to-day food what we consume, whether it's a vegetable, fruit, okay, or pulses, grains, okay, including wheat, rice, everything. Okay. But what is happening is, like, people are getting addicted to, the junk foods, right? They eat less of this nutrition food and, getting addicted to the junk foods, right? Okay. So that is the very reason, the human body is not getting the sufficient nutrition, right? Now, how to make these nutritions available to the body, right? Okay. That is where the nutraceuticals comes. So nutraceutical is the combination of nutrition in the form of pharmaceuticals, right? Okay. So these are not chemicals basically, okay, like what we see in the drugs and medicines, okay. So what we do in this is nutraceuticals are consumed in the human body by means of formulations, whether it is a liquid syrup or gels or tonics or tablets, capsules, okay, even in the form of chocolates, okay. So just to read out the slide here, nutraceuticals occupy the gray area between the food and medicine, right? Unlike pharmaceuticals, they don't primarily cure specific diseases, but support the body functions, prevent the chronic ailments, and promote overall well-being. Okay, right? So as I said, increased health consciousness, because of the, after, as Mr. Guru rightly said, again, I use the same word, like during COVID, we Indians were having the good immunity when compared to the rest of the world. It is because of our nutrition levels in body. Okay, we are better immune when compared to the global population. Okay, but nevertheless, every population on Earth had the issue. The people with better immunity, they survived better. Okay, the rest all had that face the consequences, right? So these nutrients or nutraceuticals are taking importance, okay, gaining popularity because of the increased health consciousness after COVID, particularly, and aging populations, right? So see, you must have heard or see, otherwise, even my mother at 85, she's healthier than me. I think you all agree with that point with, with the elders at your home also, right? Okay. So that's all, because of the bad foods what we have, or nutrition levels what in the current generation what we have. Okay, so we are getting older than the older people at home. Right? Okay, that's one. So that's the very reason, like, people are looking for prevention, okay, rather than treatment. Right? So we're all knowing these consequences at the older age. We're looking for preventive measures, okay, instead of taking the treatment after getting the illness. Right? Okay. So going forward, what are the categories in nutrition? Okay, how we can divide them into different categories, right? As you can see in the right side, they are categorized into dietary supplements, functional foods, and medical foods. Okay, there are some more in the next slide. You'll see that. Okay, next slide, please. Yeah, maybe I think we'll get back to that later. As you can see here, this is the overall Indian nutraceutical market. Okay. As of now, it is at 10 billion, okay, US dollars. Okay, 10 billion is nothing but you can convert into this one. It's almost 9,000 crores. Right? Okay, so it is growing at fastest pace, as Mr. Guru indicated, compared to rest all the segments. This is the fastest growing, I would say. Right? People are concerned about the health, right? So it is obviously growing at 15 to 20%, which is one of the best. For a businessman. And it is expected to reach 30 billion by 2030. Okay, 30 billion is almost 27,000 crores. These figures are only in India. Okay, I'm repeating, these figures are only in India. Okay, as a businessman, you can understand the potential. Okay, right. Now, what are the key growth drivers for this business? Okay, as we discussed in the last slide, this is high prevalence of lifestyle-related chronic diseases. I think I need not elaborate on that. Again, rising disposable incomes and aspiration, because incomes are going, people are spending more on the health and the preventive care, right? And Ayurvedic renaissance and the cultural interest in traditional medicine, right? Today, nutraceuticals, I would say, Indians were one of the like oldest country which was having this nutraceutical in place in their whether it's food or health. In addition to few countries, I would say German and Israel, I would say rather. Okay, these are the few countries which were having this nutrition as food in their day-to-day foods, in their culture itself. Okay, and increased health literacy and digital access. Okay, right? See, earlier people are unaware what is health itself, right? Now I can read, on the screen touch of this, thing like what is disease and how it is happening and all. People are getting more aware of the, health kind of thing, right? And as I again said, post pandemic, because the whole world is focusing on human health, right? And definitely knowing this, the factor, government and regulator are equally supporting this industry. Okay, next slide, please. Yeah, now coming to this, numbers globally. In the last slide, we've seen the Indian market. Now you see the whooping numbers globally. Okay, so as on today, globally, the business is 626 US dollars, and it is poised to reach across 2000, 1000 plus US dollars by 2034. Again, as a businessman or entrepreneur, I think it's the numbers speak. I mean, you know what is the potential, right? Okay, and you can gauge the numbers or the potential, right? Okay, go to next slide, please. Now, if you see who are the major consumers, right? Here it is. Okay, you don't believe? North America, okay, Europe, living Indians, rest all the major consumers are nutraceuticals because of the immunity levels. Again, I'm repeating, their immunity level is less, we are better. So leaving the Asian countries, rest all the global countries are the main market for the this nutraceuticals. I mean, as you can see, out of the $1,000 billion, what we indicated in the last slide, 36% are consumed in North America, okay, and 24, almost 25% is in Europe, right? And next is Asia Pacific countries, 20%, right? So you can imagine the numbers, okay? It's potential is huge. I mean, okay, the whole globe is looking for the health and nutraceuticals. I think one must consider this as a business option. Okay, next slide, please. Okay, so these are the types of nutraceuticals, just to indicate you, like, I mean, okay. So these are categorized into functional foods, dietary fibers, omega-3 fatty acids, phytochemicals, herbs, probiotics, dietary supplements, and carotenoids. I mean, okay, right? These are the few examples. If you can, the examples, can you enlarge it? Yeah, okay. So these are a few examples, I mean, classification based on the source, I mean, okay. And here you see the end products, I mean, right? Okay, so based on chemical composition, they can be divided into vitamin C, vitamin D, minerals, amino acids, fatty acids, phytochemicals, okay, right? See, why we're briefing these examples is because the intake of these vitamin C, D, minerals are less in our day-to-day food. Now we are forced to take these, minerals or vitamins through the form of medicines. Okay, that's what I'm trying to make you understand. Okay, so this is chemical composition. Next is again by means of mode of action. These are all. Go back to that slide. Okay, the top one was on the chemical composition. Here it is mode of action. I mean, like these products act as antioxidants, anti-inflammatory agents, right? Immune boosters, digestive aids. I mean, okay. See, not only antioxidants, antioxidants, they boost your immunity, the vitamin E and Q10 what we take in body. Anti-inflammatory, like they give the strength to the body to get immunity from the disease. I mean, like curcumin from the turmeric, omega-3, fat the fish, and even flax seeds. I mean, that way. Okay, that's how we. And based on the health and fits, the third classification is done. Okay, so it is like bone health or brain health, right? So on the basis of that one, again, one of the categories done. Okay, next slide, please. As I said here, initially I said, what is nutraceuticals, right? It's a combination of, or it's the feeding our body by nutritions in the form of pharmaceuticals. Okay, right? So in the form of liquids, syrups, capsules, tablets, that's what I said. Okay, so these are the nutraceuticals, the herbals, fatty acids, probiotics, prebiotics, vitamins, minerals, amino acid, proteins. These are formulated in the form of tablets or syrup, and humans are consumed to make it available easy in the body. Okay, right. Next slide, please. So just to understand, what are high value nutraceutical products one can consume. Okay, It is, of course, discussed in the last slides, but anyway, still too. Kind of thing. So dietary, supplements, the whole world is obese now, including me. Okay, I'm weighing 20 kg extra to my body level, right? So I think I would say, as per the data available, 60% of the population is obese. The whole world is looking for the dietary supplements to reduce their weight and cholesterol. I mean, okay, so that is one of the high-end sector one can target. I mean, right? Okay, and you all know that the these days particularly gyms has a good business. I mean, right? Bodybuilding and keeping health has become a fashion now. Okay, right? So it indicates that the young generation is looking for the better health and right? Okay, right? So they are all looking for a better proteins intake. I mean, because they are not taking by regular foods, right? I don't know how many are going to gym. I mean, if you visit a gym, the in the first entry of the gym itself, the whole shelf is filled with these protein powders. I mean, it's a big market. I mean, okay, right? And third is the herbal extracts. Okay, one example I gave in the first session also. See, this curcumin from the turmeric, boswellic acid from the boswellia, and ashwagandha extract from the ashwagandha roots. Okay, there are many like, I mean, okay. So because our regular food we are unable to intake them in the given concentration to the body, so this is a great scope that where we can or one can consider to extract these actives from the herbals, okay, and consume into the day-to-day life by in the form of nutraceuticals. I mean, okay, right? See, these are next the functional gummies. See, that is particularly to make it. I mean, okay, I would say. Uh, See this. I think we talked about probiotics in the last, right? Okay, what do you mean by probiotics? Okay, probiotics nothing but the fermented foods. Like one best example is curd, right? But most of the kids are hesitant or to consume curd, right? But the same curd, when it is given in the in the form of probiotics, people consume it. Okay, it is like that. I mean, right? So the same way these gummies are made, okay, with respect to the functional requirements of the body, to mainly to make it attract to the kids or younger generation to consume. Okay, right? And next is the Ayurvedic maternal nutrition. We all know that again, you see, when a kid or a young generation can have that ailments, imagine the nutrition level what a pregnant lady requires, right? Okay. So definitely every, young or every, population is lacking nutrition, right? So this is one of the core segment where one can concentrate how a pregnant woman can be fed with better nutrition in the form of Ayurvedic. Okay, right. So the next what we see is moringa powder. This is I don't know, however, again like it, I think amongst the herbs now, moringa powder is the highest sold product in the global now. Okay. My own company, I'm making almost 2 crore business by selling herbal powder, this particularly moringa powder. I mean, okay, right? This is having highest nutrition level, okay, across the ailments, I would say. Even in fact, I don't know about the other states in Karnataka, but Karnataka state government made it compulsory or mandatory in the schools to feed this moringa powder for to the kids. I mean, okay, this is the highest nutrition level this powder has. I mean, okay, which gives the better benefits to the kids and adults as such. Okay, go to next slide, please. So to understand business opportunities in nutraceuticals, okay, one is we can or one can consider D2C, like direct to consumers, like we can one can manufacture their own end formulated products, okay, and try to penetrate in the market. I mean, okay, and sectors what we discussed: women health, PCOS, and menopause, prenatal formulations, right? And specific conditions like diabetic support, joint health, okay, and sleep anxiety, right? People are stressed out more, I mean, okay, right? So they're leading to these problems, okay? So, and kids nutrition advantages, gummy vitamins, protein powders for children, and nutri-cosmetics. I mean, like, even this cosmetics industry, is having nutritionists in their formulation, okay, right? And this is if D2C is when if somebody can consider to manufacture on their own market. So if somebody is not interested or kind of thing, why to take that big leap kind of thing, then they can as well go for contract manufacturing. I mean, what is contract manufacturing? You are all aware. Like you see, contract manufacturing, they doesn't directly market the products. Okay, instead they manufacture the products for the people who are already settled in the market. Right? Okay. I'll put an example like Himalaya, Patanjali, or even Hindustan Liver for that matter. Okay, they have the huge market base, right? As I know, because of my 30 years in the industry, Hindustan Livers, 70% of its products they outsource, right? Even equally Himalaya and even Patanjali also, or any other factor. I mean, see, because for them also, though they're big, to set up a manufacturing facility for everything, it's one is cost and operational hassles and all, right? So definitely they bet on contract manufacturing. They rely on the people who can manufacture the product and supply them, right? That's what is a contract manufacturing. Okay. Here, what we can do, one can have their formulation development. Means if you're interested in R&D, or you're keen, and if you're a scientist or BSc, MSc guy with the pharma background kind of thing, you can have your own formulation development lab, create new sustainable products having these are the combination, right? And approach these guys that I can I have this formulation, I can deliver this, and that's not. Otherwise, you can set up your own manufacturing facility, right? Okay, so within it would cost anywhere between 5 to 15 crores, depending on the capacity what you look at. I mean, right? Okay, so you can have your manufacturing facility, approach them. Okay, say I have this manufacturing facility to manufacture capsules, powders, gums, I don't know, anything for the tablets as such. I mean, and we get into an agreement to supply the products. In this arrangement, many times they only means these big companies, they give the raw materials, just ask you to do the conversion, simple as that, right? To meet their specifications. Okay. Second or the third one is packaging and labeling. I mean, okay, right? So you don't believe the second one, manufacturers, even they outsource the packaging labeling. I mean, okay, right? Even as I remember before 15 years when I was young, I mean, one of my friend in Hindustan Liver, he approached me saying that just do the packing labeling for Hindustan Liver. Of course, I didn't consider that opportunity. That's a different issue. Okay, means the volumes are so huge. I mean, okay, people try to outsource everything what they can. I mean, okay, so I think you understood the potential, right? Okay, and the next is like you can as well get into ingredient sourcing. I mean, right? Okay, what do you mean by ingredient sourcing? Again, let's say the manufacturer requires the inputs, right? Whether it is the herbal input, say the example, let's say turmeric. Okay, so and plant-based proteins, I mean, specialty ingredients manufacturers. Okay, these are the inputs for the manufacturers. Even definitely they look out for the sources, right? So one can consider to become a supplier to them. And again, equally similarly, functional foods. I mean, okay, right? See, protein snacks, fortified, staples, functional beverages, added health benefits, and that. Okay. And next is personalized nutrition. Okay, like developing platforms to provide the customer supplement recommendation based on the individual need. Okay, right? Go to next slide, please. So just to brief about this raw material sourcing and quality control. Okay, these are the opportunities because there is a key challenges by the Indian context. I mean, okay. See what happens. Let us look at the challenges, which are the opportunities. I mean that way. Okay. The challenges are like particularly when it comes to agriculture feeds, let's say, right? So there are multiple intermediaries from farmers to processor, right? Okay, see, you must all aware that the farmers doesn't get the leads to the sell their products. I mean, right? Do you think a farmer can reach the Hindustan Liver or Patanjali or Himalaya? No, right? Okay, so that there are so many mediators. I mean, in my own personal experience, I'm telling you, when I'm trying to source something, somebody connects to somebody, somebody connects to somebody. There are almost 5 to 6, even sometimes 10 mediators. I mean, okay, right? From farmer to when it reaches the end user of the factory. I mean, there are almost 10 to 15 mediators. What I see in the market, I mean, right? So this is where you can tap. I mean, you can be connect between the farmer and the end consumer. Okay, and second is adulteration. You all know that, okay, adulteration has become I would say it's a really tragedy. I mean, like, everything what we eat today in at home also it is adulterated. I mean, that is the very reason, we don't get the required nutrition. I mean, okay. So But how long these adulterants can be supplied to these consumers? No, right? So if you can, try to supply adult-free, these products to end users, they would be happy to, collaborate with you guys. Okay. And third is again, inconsistent quality. Again, depending on the area of the crop grown or kind of thing. Okay, whether it's south, east, west, and all, the quality varies. I mean, so that's the very reason, like, the end user doesn't get the consistent quality, and they're looking for the consistent quality supplies. Okay, and third is contamination. For all certain reasons. I mean, okay, people or the farmers are, heavily or abusively using pesticides. Okay, and heavy metals are, means through water they are getting heavy metals and all of that. Okay, right. So this is one of the worry for the end users. Right. Okay, right. So these are all, these problems of the industries can be your opportunities. I mean, how we can see that, like in the bottom you see strategic sourcing solutions, right? Okay. So what you can do, you can vet these suppliers. You can be an agent who can vet these suppliers and, audit by means of quality controls and, with the GMP compliance, and you can, be a good supplier to these end users. I mean, and other form is like direct sourcing and traceability. Like, you must have heard at least heard the concept of contract farming. Okay. I would say my own example, I have an herbal extraction facility where I consume almost 200 tons of turmeric to produce curcumin, let's say, right? Okay. Even sometimes even almost 2000 tons also. Now, do I get this, turmeric in time, quality? Okay. No, right? So what to do with that, right? We go for contract farming model. What I do in this model is we prior to the cultivation period or monsoon, we sign off the contracts with the farmers. Like, okay, we fund them for the seeds also or fertilizers also. Okay, see that they grow the quality turmeric suiting our requirement, industry requirement. Thereby, we assure our quality supplies and in-time supplies and quantities also, right? So this is called contract farming to ensure my industry doesn't suffer because of the deficiency in the supplies or the bad quality of the material. Right? Okay, so this is one of the big opportunity one can enter. Okay, to be a bridge between the farmers and the consumers. Okay. Now again, standardize the extracts. So like there are many industries who are already producing, let's say, right? But again, they're not standardized, right? So you can be a middleman between them, like purchasing extracts from the producers already. You can check it and supply to these end consumers again. Okay. Okay. Go to next slide, please. So coming to regulatory approvals and market authorization, right? Because these nutritions are gaining importance in the market. Definitely, they are under the regulatory. Major approval authorities are FSSAI licensing is important. Okay, one is we can have central licensing. Second is the state licensing. Okay, right. So central license is required for large manufacturers, multi-state marketers, and importers. So if you are looking for throughout India market or even the international market, one need to have a central license from FSSAI. Okay, and second is for state license. Okay, for similar manufacturing, but operate within a single state. Okay, say if at all you want to operate in Karnataka, Maharashtra, kind of thing, we need to have a state license. Okay, right. So going forward, just to see path to market authorization, like we need to have ingredient compliances, right? Ingredients we cannot use left and right whatever I think, right? Okay, so the ingredients must be approved by FSSAI or the similar authorities, whether it's vitamin, minerals. Okay, they should be within permits limited. Why? Okay, I'll tell you today's example itself. I can read one of the article. A few of the kids in a school, they were admitted to a hospital because of the overtake of iron. Okay, means even excessive or abusive use of these minerals also bad for health. Right? Okay, so that is where the vitamins and minerals what to take, it should be in permitted limits only, right? So one cannot take 10 tablets of iron supplements, right? Okay, that way it has to be one or two as prescribed by the nutritionist, right? Okay. Similarly, herbal ingredients also, like you see, again I will use the example of curcumin from turmeric. Knowing that it is good for health, we cannot take more than 10 milligrams per day. Okay, so excessive use, again it will lead into side effects in the body, right? Okay, and again, and as I said, quantity limits. Okay, see, every ingredient there is a limit prescribed by the body, particularly FSSAI, let's say. Okay, so we have to adhere to that. Okay, and adhering to purity standards also, right? Okay, because if we don't use the quality products, so we'll be inducing more of the impurities to the body, right? And second path is claims and compliances, right? Like you see, if you see, like in a product, what is permitted to claim, let's say, right? See, you can see in the second middle of that one, what is permitted is like we can claim as we are providing calcium and vitamin D, which supports the bone health. This claim we can make, but we cannot claim that this product cures osteoporosis or arthritis kind of thing. Okay, again repeating, these are not the curing. Okay, these are not the medicines, right? Okay, so we can only claim that this will support in your health, building your health immunity kind of thing, right? This is the a claim compliance one has to consider while manufacturing it. Okay, so as usual, again a third bottom you see labeling requirements. Okay, like nutraceutical health supplement declarations. FSSAI logo is must. Okay, without FSSAI unlicensed number cannot sell the products. Okay, and the nutritional information is must. Okay, whether it's regulatory or otherwise also, these days people are educated. They look at what exactly the contents of nutrition levels in the product. So this is must in the labeling. Okay, and advisory statement, like this is not for the medical use, right? Okay, as I said, these are all the not medicines, but health supplements, right? Go to the next slide, please. I think that's it for my end. Hope you all liked actually. Now,
Yeah.
Okay, give it to Mr. Sundar.
Yeah.
Thank you.
So I think it was a wonderful session trying to understand, what kind of opportunities exist in the nutraceutical sector. Although we all know what nutraceuticals are, and what kind of products that are required, and like how you said, other than India, every other market is huge, basically because traditionally or culturally their consumption of some of these products has been very low, and that today is being taken care by the nutraceuticals market. Also, I would like to highlight that a lot of new entrepreneurs are looking at becoming contract manufacturers to the big players, like how sir was mentioning. There is Manipal who has come up big time into this. Recently, I heard Apollo also has got into the nutraceuticals market. So, lot of existing allopathy related products or companies are also including nutraceuticals within their ambit. So the opportunity by and large is huge, although a few government regulations have to be looked at, and since it's also a developing market, a lot of these regulations are kind of changing day by day. So government or some of the the health ministry, some of the regulations are sometimes new, or it is changing rapidly. So it is very important that the entrepreneur, when he's trying to get into nutraceuticals, he needs to understand whether he is going to make his own product and get into the B2C segment, where he'll be marketing them on the D2C channels or on the independent channels, or if he is going to become one of the contract manufacturers for the bigger brands. So these are the two areas that he'll have to take it upon. And further, looking at the government regulations and what are the the requirements that are supposed to be adhered to, I would call upon Mr. Sundar Raj, who is an nutraceutical industry expert, We'll also talk about his journey with the how the seaweed and the algae-based market is shaping up as well. Over to you, Mr. Sundar.
Yeah. So happy and thank you, and very happy and privileged to be presenting in this AIM 2025 session. So happy for I'm thanking to Solution Buggy for this opportunity. So I'll introduce myself. Myself Sundar Raj, founder and CEO of Z Corp Organic Private Limited. We've been in this industry. It's our 10th year. We have started in 2015 as a small farming company. We have our own farmlands. We were farming value added, like us. Sir said, we were doing moringa based products and moringa farming and all in initial times. So that the growing demand of moringa have been like driving us in a good growth, so that we wanted like some changes to be made in this particular industry. Some products or some like a revolution need to be made uh, for a sustainable procurement and sustainable supply chain. So that time we got a small knowledge about seaweeds, that is like micro and macro algae from Indian Council for Agriculture Research. So we joined hands with them to study about that. Over the year in 2017, 2018, we had a great time with ICR. We studied a lot about seaweed, and we started our own farming of seaweeds. So in a short brief, we have our own farms in Indian coastal, in Tamil Nadu coastal, near to Rameshwaram. We have our own farming in Indian coastal Rameshwaram and in Lakshadweep. So talking about this seaweed, micro and macro algae, like as sir said, after COVID, pre-COVID and post-COVID, those things are there. Like after COVID, how this moringa and other value-added products got huge potential, like that this spirulina, like microalgae spirulina, had a bigger that is a known and very popular algae that is prevailed in not only Indian economy, in over international economy also. Spirulina is the one algae that everybody knows. So algae got a like a brand because of spirulina. So I'm planning to utilize my time to give a small brief about what is algae and how it is being used, and how it can be it can be good for the future, as in not only nutraceutical, pharma, and even in food sector. So when it comes to algae, spirulina, there are two major variants. That is, one is microalgae and second is macroalgae. So microalgae are single cell organisms that are like spirulina, chlorella. Even in the variant of spirulina itself, we have different variants of spirulina that are like grown in different way, temperature, atmospheric condition, and everything. So this others have a higher level of this microalgae like spirulina and chlorella have that are all freshwater algae that can be cultivated in freshwater, and that will be having a huge number of abundant proteins, amino acids, and minerals are there. And extraction compounds like phycocyanin and other things are available in microalgae. When it comes to macroalgae are plants that are grown inside the marine ecosystem, that are salt water, like not we can say like salt water, that is seawater plants. This seaweeds are. So seaweeds have been seaweeds like microalgae and seaweeds have been a great in Asian countries, including India. Asian countries, all Asian countries, seaweeds have been like a huge potential food source, not only food source, nutrition source from our ancient times to till now. Still, you can like everybody can see in China and Japan and Korean countries, this nori sheets have been used for sushis and all. So seaweeds is an vital part of all economy, and vital part of health, wellness, and even food sector. So we planned to elaborate this seaweeds into a general market. So in 2017, 2018, we have launched we have studied about the seaweed. We started cultivating we started with 20 varieties of seaweed in variant seaweed varieties. Now in 2025, we have nearly 120 varieties of seaweeds that are cultivated in both our Rameshwaram and Lakshadweep coastal with the help of Indian Council for Agriculture and Research. Not only we are cultivating, we are supplying, we are supplying our products to major companies like Cancor and Synthite for extractions, various extractions of antioxidants, lipids, amino acids, and pigments. Yesterday, my colleague George would have been if somebody was in the yesterday's thing. So the seaweed cookies and seaweed green tea and seaweed salt would have been presented. So we have our own brand of products that are made from seaweed. So we haven't not only we shown the path of like we can do the farming and seaweeds can be used. We've made products and we branded that products and we sold the products so that people who are coming to this market will know that awareness of seaweeds will happen. Then when so this is a short brief about seaweeds. Then when it comes to nutraceuticals into health and wellness revolution, so seaweeds, seaweeds are when we take moringa, as sir said, moringa and other curcumin and ginger, and it is all crops are like we wanted to cultivate this all crops in the landfill. Sustainability. What are the process that are happening is that one is we need a sustainable farming method. We need a farmer which have a land, and the cost of production is very high. But when it comes to seaweeds, seaweeds are marine grown plants. Marine one is marine grown plants. In sea, we don't have an limit, so we can cultivate as much as we want, and we can harvest as much as we want. And again, when it comes to seaweed, if we take one variant of seaweed, that seaweed will have multiple percentage of items. Like proteins will be there, amino acids will be there, antioxidants will be there, tocopherols will be there. So one variant of seaweed can provide this all things. So this is the potential of seaweed that we are bringing. So as an example, I can give we are extracting beta carotene and carotenoid and antioxidants from seaweeds that are used for various nutraceutical process. Like a beta carotene and others used for multiple components capsules are made from that. And these extractions are also used for various lifestyle disease conditions also. And seaweeds can be other than any other product, seaweeds can be intake as a we can take in as general products that can give you and it's a huge source of general protein also, and a balanced diet too. So then when it comes to seaweed, the cost, so cost is also we can't say it is cheaper as the farming and other procedures are emerging in our country in India. So the production cost is little bit higher, but compared to other products that we are using for extraction, seaweed is much cheaper when it comes to economic and then a business model. So we ourselves have a farm and we are ready to collaborate. We are collaborated with Solution Buggy for various projects based on seaweeds and non-seaweeds projects, and it is very happy to connect it today in this meeting also. So in nutraceuticals, when it comes to nutraceuticals that are already sir have given a huge brief about this nutraceutical and other things. So what I will say is in India, not only in India, I'm saying in the worldwide, nutraceutical market is gaining a boom. Again, there are some drawbacks that are happening, but with the correct mentors like Solution Buggy, and with correct mentors with correct contract manufacturing team, and with the correct guiding team, we can achieve a huge, like I'm saying, like huge change in the market. The one bigger example that I can give is like Goodbug. Goodbug is like they only focused on the prebiotic and probiotic area, and they have given they are giving it in a multiple area, like in capsules, tablets, and everything they are giving. So today's nutraceutical market is huge, and the tapping of even we take a 1% of nutraceutical market is also, it is like in a crores. What we need to do, what we need to keep in mind is one thing. We wanted to plan our product. First is the perfect market study is needed, where you are going to pitch and what kind of solution are you providing to the problem. Like I can see Goodbug as an example. So Goodbug haven't, like, they haven't gone for huge variant varieties. They only focused on gut microbiomes, and they only launched one variant of products, and that can tap into a huge market. So when a new startup is coming into the space of nutraceutical, I personally advise to them, focus on one problem and bring a best product with good vendors and everyone. Focus on one product and bring that product into the market, and make that product very good. Like, study about the product, and as sir said, be keep very strict pathway with Foscos, Ayush, and other licensing things, and keep a good track on your ingredients, raw materials, your formulations, and your sourcing, supply chain options. Keep all this in mind, and this all thing need to be done in an proper mentor guided model, so that you can achieve a huge growth. Like as sir said, sir is doing moringa products, and he is making a huge market. So he focused on that moringa, sourced it well, and made that whole product into, when the customer is getting in hand multiple products going, like we are doing curcumin, moringa. There's a new startup I'm saying doing more curcumin, moringa. So the traceability will be very less as you are a new startup. So what I say to a new startup, focus on one product and build that product to a best market, and focus on initial market, and then do best market research and preliminary research also. Please do. So when it comes to clinical trials and safety studies nowadays, I said one word. I said is was drawback. What is the drawback? Is credibility, the validation. When you take any product nowadays, this lot of MLM companies have came into nutraceutical arena, and they have polluted the market. So people are very focused, as sir said. People are like very looking into the nutrition table very much. So what you wanted to do is, you wanted to choose one product, and as I said earlier, one product, and make that product as your basic product, and do a proper study, not only in the initial stage, even in formulation. You do multiple formulation, do a safety studies, and create a vast clinical trial model to bring that product into the market, so that you can create a credibility and a validation among the customers. So the customers are very important. So one small and good story that I'm happy to share with is, like, I was in my, like, in a function 2 days back, and I've heard about this. Most of the people heard about Herbalife and other MLM model nutraceutical companies. So one of my colleague and one of my friend and relative told, I'm into Herbalife, and we are supporting that Herbalife products. And okay, not an issue. I said not an issue. But then I asked him, what are you providing? So he said, I am a well nutritional coach. This product can give you this much thing, this product, and they are also doing a lot of this vitamin, other things. But then it is creating a bigger problem in market, because without proper studies, clinical trial, other things, it is creating a side effects in the long term use. So multiple products coming into one junk, that will create huge problem in the market. So I'll suggest to a startup who is starting in the preliminary, take one product and do the best formulation, do best clinical trials and safety studies, study well, and do a vast clinical trial and execute the product. Even when you're going before to the market, do a trial sampling, trial marketing. Keep stick on with various doctors, and discuss with them. With the help of Solution Buggy, you can get all this help in this market. So keep stick on to this process and create a good product and focus on one product and give high value. Keep on your raw material supply chain very stringent. It should be very quality. The procuring material should be from the day one to the end day. When you are whenever you are selling, the quality should be A grade only. It should not go to B or C. In the mind of like profit or anything, you should not go to B or C, because uh, nutraceutical is a like in today market, 8 billion to 10 billion market is going on. So that much people that much people are giving a hope in this nutraceutical. So growing this market is in our hand. So growing it in a well manner, so that our future beginning startups also can reap the whatever we are sowing. So this is what when it comes to clinical trials. So when it comes to a technical model, when you are starting into a product development, first of all, initially study what you are doing, and then what kind of studies or clinical trials that need to be made, and what kind of persons you are planning to focus when it comes to beta carotene or carotenoids or antioxidants. What kind of age group you are planning, and what all implications are there? Are these products very stringent to or creating any side effects in the long term intake of any, is it making any side effects for various like diabetic conditions or any other conditions? So keep track on that and do a detailed study. And nowadays this supply chain is very important. When you are purchasing your raw materials, do an initial quality study. The whether that particular, as earlier, I'll give an example on that too. Like earlier, as said, sir said, when you were taking a ginger or curcumin, you wanted to go and physically you wanted to check the quality of your ginger, your turmeric, so that you can get a good quality or good purity percentage of curcumin or any other extracts from your item. So do a good study on that. The next slide, please. So research trends in nutraceuticals, so that nowadays, like in modern day, in modern going on stages, as sir stated, lifestyle diseases are there, and malfed is there. I'm saying not malfed, I'll say it as an unfed. Like we all, earlier it was the junk problems. Nowadays we are skipping our food itself. Lot of people in their busy schedule, we are thinking of okay, having something and going is okay. So that is like unfed problems are there today. That is what the first thing is, gut microbiome is there. So we are not taking our food itself, so that the gastric juices in our gut are making our stomach into a junk pile. So that is where this gut microbiome uh, gone into a worse thing. That is like a very best example is this good bug, and very best example is this yogurt based prebiotics and other things are also a good example for this gut microbiome. And the next topic is very interesting. Ayurveda meets modern science. Yes. So nutraceutical is a modern Ayurveda actually. In earlier stages in Ayurveda, there are a lot of technical names, Sanskrit names, because I'm when I had some Ayurveda medicines. When we are going to this Ayurveda stores, they will say like Ashtanga Legium and some kind of different. They'll say complicated name. That complicated names are very tough to understand, and we don't know what to take and what not to take, and what kind of things are there. So this particular Ayurvedic medicines are very tough to understand also, and we will forget it. We'll forget it also. So Ayurvedic industry was very tough to get into one bigger success like pharmaceutical or other things. But modern nutraceutical is our old Ayurvedic science. So whatever our old Ayurvedic science given, that extracts, plant extracts, or any extract that are given, In earlier time, what was the problem in Ayurvedic is there is no standardability. When you are making a like syrup or a lithium or some kind of things, there is no standard procedures are there. They are taking a lot of like 1 kg ginger is taken, 1 kg turmeric is taken, and other products are taken, put it into a this heating chamber, and it is heated, huge temperature is gone, and then a black color of lithium or liquid will be coming, we will be taking it in an ounce. So there is no standardability, whether we don't know what kind of bioavailability will be there in that, and whether that particular ingredients are heat stable or nothing, we will be knowing. So in modern like nutraceutical, this all problems are solved. The bioavailability is checked with the testing and other things, and the validation, clinical validation is happening, and everybody is reachable today's nutraceutical products. In earlier, if you wanted to reach an Ayurvedic medicine, you wanted to go to an Ayurvedic doctor or a Siddha person or anyone to get that product and to know the details you want to. But in modern nutraceutical, you will know whatever it is in the, it is the old Ayurveda made much easier to this modern nutraceutical. And when it comes to the next topic, plant-based protein innovation. So earlier, when we were like when I'm also young, still I'm just in my 30s, and but still, when in my childhood age, my mother used to give me this tapioca starch as my early stage food. So she says like tapioca starch as an early food will give you good protein, and it will create a good gut based thing. And when I am growing up also till my 20 years of age, my mom used to provide this moringa powder, chutney powders, and other products. Why? Because why they have in early stages given this plant based spinach and other products are very good for our health. Nowadays, people don't know what is spinach and other things. Even when it comes to metro cities, when we go to Bangalore, and we can't see this spinach. Variant spinaches are there: red spinach, green spinach. Even moringa, sir said that after the revolution only people know moringa is a leaf that are grown and that can be consumed. So now, so what in nutraceutical nowadays nutraceutical is giving back is they're taking that plant based proteins, whatever tradition, they're taking it into a modern way of giving as capsules, as tablets, as powders that can be mixed with anything and having. And other next topic is like functional foods for lifestyle disease, that already we know. Yogurt and other things are getting very traction nowadays. Again, these all things, nutraceutical is an modern word that is living from the old age. That is what I used to say in one word. Nutraceutical is a modern word that we have created with nutrition and pharmaceutical clubbing. We have created a name called nutraceutical, but from old age it is there with us. What our mother, what our tradition, what our roots have given, we changed it into a name called nutraceutical, and we given it a new shape, like whatever we had, like maybe sir would have known, like in his earliest stage in his childhoods, he would have had this ragi mudde in Karnataka, and all ragi mudde is there. Nowadays we change that into ragi powders that can be used into any pancakes or other things. So the shape is changed, the intake form is changed, but it is what our tradition is. So whichever startup is going to start, keep this as an your jawline for this, or keep this as a tagline for this your product, or baseline for this your product. Whatever nutraceutical product you're making, it is from your tradition. So keep that. Even moringa also picked up a pace because of that. Moringa was already there, so we were pitching that moringa from mother to the garden, from tradition to our table nowadays. So that is one thing. And personalized nutrition, nowadays people are very aware, as they are unfed, as much as they are aware also, because the social media and other things are getting very high. So, and nowadays this usually earlier stage we were gone to doctor to check out check up our blood and other urine tests. So nowadays, people are going for nutrition testing. What kind of deficiency I have? As sir initially said, I have an deficiency of B12. I am taking tablet. Like as I said, I am also taking this nutrition tablets like this moringa capsules and other things. Usually, I used to take. So this personalized nutrition method is also people are getting very much aware. I am deficient on this, so I need this particular thing. I am deficient of my gut biome. I need an solution for that particular thing. So you target those people also. To create, that is what initially I said. Study the market and what kind of problems are happening there, and give a perfect solution and keep it keep some good mentor aside like solution buggy. As I said, yeah, like solution buggy, keep a mentor with closely with you who can guide you in the best pathway. Next slide, please. So government initiative supporting nutraceutical. Government is always supporting your any works. We wanted to know how you are going to pitch it up. So when it comes to nutraceutical, everybody have an idea whether we wanted to take a drug license and other things. Nutraceutical is not coming under pharmaceutical. So every startup, when I'm encountering them, they used to ask me, sir, the nutraceutical is a bigger. Nutraceutical is actually simple. It is food converted to modern capsules and tablets and other things. So there is no need you need to go to a farmer or drug license or something. You wanted to get an FSSI food safety license from a proper knowing person. That can be again I'm taking account into social solution buggy. You wanted to consult with them for the best FSSI and food safety regulations. Since you take a good education on that, whichever product you are doing, you please check their compendiums, whether your product is listed in the FOSCOs, whether your ingredient is listed in the FOSCOs, and what is the regulated dietary grammage daily you wanted to take. You check that and take a best FOSCOs food safety license. And if you are going into an herbal model product, if this particular your whatever raw material you are making, that raw material is a general plant-based extract, you can go with FSSA. General FSSA is okay. If you are making it into herbal extract, or if you're going it into it some different shapes, some paste or other thing, get an Ayush mark also, so that can build your credibility with your clients. So there are a lot of incentive schemes from Startup India, MSMEs who are ready to support. Even in MSME, you can, if your product is very good and it is you need to have a USP. If you wanted to take patent also, MSME will support. If you are a new startup, MSME will support you with the sufficient funding for your barcoding, trademarking, and your patenting facility. So that also you wanted to go with a proper consulting person who can support you in all your stages. Again, I'm taking solution buggy as the uh, into account. And public health, we all know, like our PM Prime Minister Sri Narendra Modi ji have given millet year. Last year was a millet year, so upcoming years will be like if again they're coming into the central government is planning to make this next year coming into as a plant protein year. So plant proteins are the focused area next again coming, and they're focusing on seaweeds also, seaweed farming and other things also. So government is supporting every in all the nuances and nook and corners. You wanted to get a good mentor and guide and stick on with them, get a good knowledge and get into market and and have a good backup on all the things. Next slide, please. Export opportunities on global demand. This is a very interesting and very happy like part I wanted to discuss. So in worldwide, India, we all know India is very much abundant with all the natural resources. If you take in the worldwide, as sir said, Moringa is the revolution of Moringa started from India and Sri Lanka. So like that, India have a huge and abundant resource of all kind of herbal, all kind of, even when you take a geotagging, now this turmeric geotagging, like US and other companies are like other countries are like taking, but still the whichever herbal product you take as a geotagging, it will be in India. Ginger, turmeric, moringa, everything will be in India. So India have a huge potential of this herbal extract. And India is the first country who is doing literally nearly 100 to 150 varieties of herbal extracts worldwide. They are exporting. So opportunities is abundant. Opportunities is abundant. You wanted to pitch into the correct space, like very you can take moringa as an inspiration, moringa curcumin as an inspiration. You can take so that made a huge this thing, like in even in UK or even the other countries, these countries are like searching for herbal powders and herbal products, like spirulina and every product. There is huge demand. You want what is the what a startup need to have initially. One, they need to have an idea what is the global demand happening. One time in the COVID time, this ginger, curcumin, turmeric, and moringa, those kind of ashwagandha, those kind of products has been like a huge demand. Now, if you are starting, you wanted to study the global demand. What is the product that is going in demand, and you wanted to source that in a natural and clean label model. And please stick on to our Indian FSSI model, and please stick on to US FDA, and if you are and other countries EUFA, European standards. You please stick on to that. Do testing, do the correct testing, and traceability is very important in export. A lot of export companies like startups are getting lot of exports opportunities, but nowadays I'm seeing lot of startups are failing in the export. Why? Because they are like jumping it into the suddenly jumping. They are not having the right mentoring team, and they don't have the correct idea. Because however the export opportunities and global demand are there, there are huge risks in this particular domain. So we wanted to know what are the risks associated with this particular product. Keep a good guide or mentor. Again, I'm taking account solution bug in this, and you can like take this into please take that into the account, and keep a traceability of your all raw materials and products, and stick on to the regulations also. So that is what when it comes to export opportunities and global demand. Whenever you are starting an export opportunity, study the opportunity, study the demand, and then slowly jump into the opportunity. Next slide, please. Quality standard certifications and validation. So we already discussed on. You are taking a raw material, when you are planning it into a nutraceutical domain, you wanted to have a validation. That is what again I already said. The MLM companies and other have polluted the market. Where you wanted to stand out is on the validation process. So you wanted to keep a good mentor with you, and you wanted to know the process of validation. Once a raw material is procured, if it is in curcumin, beta carotene, vitamin A, vitamin B12, any raw material is taken, please keep a traceability and validate it in a technical form, and check into a quality method, and do analytical testing, lab testing, and then get into the manufacturing process and lock the vendor, and create a basic testing, and each batch should be the same as the first one. Okay, and check the raw material daily dosage with FSSI, and make a standard operating procedure for all your nutraceutical products, because these are all like human consumed. So you should be very much focused on the first to end process, and stick on to, and get into an like take all certification process, like you volunteer into that, will create a good validation of you and create a good credibility of you to the customers when they are seeing this is non-GMO project verified, and it have a good USP, and it is created with a good like organization, and you have enough certification. People will come to you. People will come to you and grab your product. Other than that, if you are just you wanted to like in a mode of money making, so it won't last long. If you wanted your startup or product nutraceuticals need to last long, keep all this process in your mind, and keep one thing is validation. Every time it is need to be validation. I'll give you a small example on that, like our like a director of solution, Bagi sir. So when he's saying IIM, IIM is a validation actually. So it is a validation. Why that validation is important? He have studied in a correct manner and he can guide us. So that is a validation. The same validation should be there in your product also. In your so you should be, your product is came from a good space, and your product have all the qualities. That qualities is validation. That validation will give you a long-term sustainability and scalability. Next slide. In technical validation and product testing. So when you are taking when if you are a newcomer or you are just starting a nutraceutical project again, what from my side I'll suggest is like, initially when before creating a formulation, do a validation on your raw materials, the availability of raw materials, the processing of raw materials, the bioavailability of raw material, and what kind of purity it is having, and what kind of stability is there, and whether this particular raw material, whichever raw material it can be, vitamin B, vitamin A, anything, alpha, tocopherols, even fucoxanthin, ficoxanthin, anything, it should be in raw material stage itself. You should have all the tests to be done. Put a lab test on that and create a quality chart on the raw material, so that it will help you in the manufacturing process. And when it comes to manufacturing process, again put a validation test. Like keep on do a quality testing from initial, from it is entering into your space till it is going out. If you are giving it into contract manufacturing, keep an account on them, and keep an account on you also, so that your product will be very quality, and the finishing and the customer reachability and whatever the quality you are thinking, it will be there. Next slide. So
Yeah, I think
interesting. Yes, yes,
yeah. So
yeah,
we are just putting in a poll there. So I think it
yes.
was a valuable insights into the government regulations, and also the kind of step by step process that an entrepreneur has to follow to get into the nutraceuticals market. Uh, as we are moving into the question and answer session, I think the participants will be having a poll that is coming up on their screen. It might take about 30 seconds to complete this poll. Please have a look at it. About 5 to 6 questions will be there on your screen. Kindly answer them. It will help us in understanding what kind of profile that we are talking to, the audience profile and the target segment, and also help you in understanding your own potential in terms of the nutraceuticals market. So I request you all to answer it. If he has missed the session, you can look at the poll icon in the bottom of the screen. There also you can click on it and answer the questions anytime during the call. As they are answering the poll, one question to Mr. Sundararajan
Yes, sir.
regarding the seaweeds.
Yes, sir.
So, is seaweeds can be manufactured or can be grown in an indoor area as well?
Yes, actually, it can be grown in an indoor area. So there need to be like, if particular variant is needed to be grown inside, we wanted to create a marine ecosystem inside an indoor space, because these are all, the seaweeds are not a freshwater product, that are all completely grown inside the marine ecosystem. So indoor cultivation is possible, and there are a lot of international countries also, even in Indonesia, indoor cultivation have been proved. but again, it needs a huge infrastructure to create an environment. But what I'll suggest to any newcomers as with this question, our in Indian coast are
Yeah.
very good and potential to cultivate seaweeds as such in the area. Why I'm pitching that idea, because it can not only you are creating seaweeds, you can create job opportunities. You can create job opportunities for the coastal communities, and that will give you a credibility, and that will give you credit in the government side also. You can get some funding from them. So that is a bigger opportunity, that is service part also we are doing. Yes, sir.
If somebody is trying to buy seaweed from you, what are the potential opportunities that he can look at, and what kind of, like, will he repack it, or should he do some extraction or processing after that? So what is it that he can look at?
Sir, we are doing nearly 120 to 150 varieties of seaweeds today. So if anyone wanted to buy seaweeds from us, initially we will be sharing them with our catalog of seaweeds that are available, and they can check. And that particular catalog will have like we will know the like. I'll give an example on that. Like we are serving our products to Canker for antioxidant and protein extraction. So initially they have given an account of like we wanted to extract protein and antioxidant from seaweed. So if a client is coming to us and they wanted to do something with, they wanted like I wanted this thing to go for an umami or protein balanced diet is needed. So we will suggest them seaweeds with the data sheet. So they can look into the data sheet and they can take the samples. Samples will be processed by us. We can dry. We have all drying equipments with us. We are doing we can do the drying process and everything, and we can pack them whichever form they wanted, powdered, shredded, dried form, even live form also we can support. Yes.
Right. Right. Thank you. So the next
Thank you.
question is to Mr. Krishna. Since you're already doing the moringa-based powders, do you also see a big market in these sprouts and microgreens? And if somebody can get into this and extract vitamins and minerals from them?
Yeah, definitely. See, as I keep on telling in my last session, now also I'm telling you, there is an opportunity in everything, sir. Everything. Okay. It's all, how you look at it. I mean, simple as that, right? Okay. See, you might be seeing, in and out every day, many people going out of the industry, many investors coming in. I mean, okay. It's all, if somebody is saying there is a failure or they're unable to do business, it is because of their, mishandling of the business outside. Otherwise, okay. Otherwise, it's plenty of opportunities. I'll give an example, as Mr. Sundar was talking about. In USA, one of the Indian company or Bangalore-based company is one of the largest, uh, organization in US, which is having their base in the name of a brand name of Sabinsa. I think Sundar will agree with me. It's a Bangalore-based company, a company called Sami Labs. Okay, right? He's a Keralian, set up this industry last 23 years. Okay.
Yes, yes,
That was
yes.
my first job, what I did, before 30 years. I mean, okay, I was there for 1 year in that organization. Okay. Today, their market size in US, okay, just for nutraceutical is almost 20,000 crores. Can you believe it? Okay. They got so many variants of nutraceuticals, I'm telling you. Okay, that is the base created in the US. And again, there's no shortcut. They are complying to all requirements of their US or European regulations. I'm telling, come anything, they're ready with answers, quality aspects, anything. I mean, right? See, because these international countries, particularly US and Europe, they're very stringent on the quality aspects when it comes to the health of their public. I mean, okay. So definitely, one has to adhere to the quality requirements. Otherwise, there is a huge market. Okay. And just to go for again continue the discussion, in US, this nutraceutical have become their routine. I'm telling you, everybody are backed up with these nutritional supplements. Without that, they can't live. That is the condition of the citizens in US, I'm telling you, right? Okay, and similarly in Europe also. I think very soon this will become a norm in India also. As I see when I go to Narayana or any Apollo medical or any chain of medicines, I'm telling you, They have a nutritionist based in their hospital. I think you must have seen all these days, right? Okay. So with coming days, now with the kind of ailments what's being in the market at the younger age itself, okay, now nutraceuticals become a part and parcel of our life, I'm telling you, okay, right? And one example I would say, recently we did like one of the UK customer. He wanted to, his challenge was how to sell these, product, in the market, because they feel that they're in the form of tablets. People have a dissection when they see tablets, right? They feel like, I'm taking medicine rather. Then how to make it attractive, right? So what we did is this curcumin or boswellia or any other herbal extract, we have formulated in the form of chocolates or chewing gums, right? Okay. So the moment you do this formulation, everybody, I eat at least 10 chocolates a day, right? So that is, indirectly, by default, it is consumed by every, kids are attracted to, chocolates, right? Okay. So make that as an ingredient in your chocolates or cakes, whatever it is. Right? Okay. So that is how we can create an interest in the general public, irrespective of ages. I mean, okay. So kids like chocolates, toffees, make it available through that. Youngsters, like something else, make it, right? Okay, kind of thing, right?
So,
So,
I think,
sorry,
yeah,
one word.
yeah,
Just
please.
what Krishna Shetty said, or Sundar said, or Mr. Guru said, I would suggest people, please do what you love. I mean, okay, you should love what you do. Just it is because Krishna said, Guru said, and looking at 1,000 crores or $1,000 billion and all, don't get into that whatever we said. I mean, okay, whether it is a simple moringa market or the like critical product, anti-cancer product available in our herbal extract. You don't believe curcumin, the turmeric extract, 99.99, it is used in anti-cancer applications. Okay, right? So, but again, you should love it. I mean, when you love the subject, you can do miracles. That's I can promise you. Okay. Thank you. Thank you, sir.
Sure. A question to Mr. Sundar. Other than seaweeds, are there other sea products as well which are being currently used in the nutraceuticals market?
Sir, can you come again with the question?
Yeah, so other than seaweeds, are there other marine-based products which are used in the nutraceutical markets?
Yes, sir. Currently we are only doing with working with this seaweeds. Other than the marine products are there. One is we can say is like phytosan from shrimp and alginate from fish scales and marine collagens from our basic fish and cod liver oil. Cod liver oil everybody knows. So Indian fishes that are mainly from Gulf of Mannar and Pacific Ocean, high amount of omega 3, omega 6, omega 9 fatty acids. So that cod liver oil is the best marine product that got boom and that again getting boom. This phytosan and alginates and other collagen products are coming in the market. Marine collagens can be focused by a new coming startup. So that have a huge export opportunities also in the collagen market. Because collagen when it comes to collagen, bovine collagen, marine collagen, and plant collagen is there. So bovine collagen, we all know it is extracted from the bones of the animals, cows and other bones. So the problem in that is like that can create lifestyle side effects in the long run process. When it comes to marine collagen is the very healthy collagen that can be used for a long process. So we suggest, other than seaweeds, newcomers can concentrate on chitosan from shrimps. Chitosan is an enzyme that is like antimicrobial and antioxidant, antibacterial that can be used for various shelf life exceeding processes and other things. Chitosan is made from shrimps and other products. Again, alginate is there. Alginates are calcium products that can be used. So again, with collagen, these products can also be a bigger market other than seaweeds.
Right, right. Thank
Yes.
you. So I think
Yes.
we've had a wonderful session today. Again, gathering a lot more information on the nutraceuticals market. than we knew, and also understanding, the kind of rigorous requirement that is there in this sector. We have a lot of questions that have gone unanswered, but do not lose hope. Our team will reach out back to you, and we will get those questions. If we are not able to answer, we will have the experts talk to you and answer these questions to you. I would suggest that the entire audience should attend the next session as well, which is mainly into packaging and the different kinds of packaging opportunities that are available. With that, we come to an end of this session, and I would definitely like to thank both our key speakers, Mr. Krishna Shetty and Mr. Sundararajan, for sharing their valuable insight and also agreeing to spend their time with us in educating us in the nutraceuticals sphere. Thank you, sir, for your contribution. And also thanks to the audience for being so patient with us, and also answering asking the questions that you have had. Thank you, one and all.